Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Prakhar Gupta, practicing as a diabetologist and physician in Agra. And today we are delving into a silent epidemic that India is combating, that is the heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike in Western countries, where heart failure is predominantly a disease of the elderly. Let's break down 5 essential insights on heart failure. First, what does it mean when a doctor tells you that you have heart failure? Well, when people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure itself is frightening, and it simply means that your heart is struggling to pump the blood as effectively as it should. The ejection fraction, or the EF, measures how well your heart pumps blood. It is the amount of blood pumped into your heart's lower chambers, that is your ventricles. In normal population, the normal EF is around 50 to 70%, and typically we say a heart failure with reduced ejection fraction at about 30% or lower. Secondly, why are so many Indians affected with heart failure? Well, genetic plays a significant role in that. Indians are genetically more vulnerable and more prone to cardiovascular diseases. Furthermore, hypertension, diabetes, obesity, and smoking habits worsen this endemic. Moving on, what are the signs and symptoms that I can get if I have heart failure? Well, it's boiled down to confusion, fatigue, heart palpitation, that is, feeling of your own heartbeat, nausea, shortness of breath, and weakness. There is also loss of appetite and vomiting. How can we protect ourselves from this disease? Well, our heart works incredibly hard to keep us alive. There are 5 golden rules that we can follow to return the favor. First, early detection of heart failure through regular blood tests, dietary adjustment to maintain healthy heart, incorporating daily exercises into your routine, aerobic or weightlifting as well, practicing stress management techniques, quitting alcohol, tobacco, and smoking. Lastly, what comes next after the heart failure is diagnosed? Well, nowadays in modern medicine, there are a lot of effective medicines which can help you to lead enjoyable and meaningful and productive life. So, don't take it lightly. Take medicines regularly, and advanced treatment with devices like biventricular pacing, implantable cardioverter defibrillator, and heart wall repair are also available. Also, the last resort treatment heart is transplant. The lifetime risk of CHF is 1 in 5 for both men and women. Remember, awareness and proactive measures are key in combating this silent epidemic. Thank you. Thank you to all our listeners.